Our next speaker is she's not a doctor yet, is Emily Dwosh, who has worked as a genetics counselor in the Alzheimer clinic for a number of years. And she is with the UBC Faculty of Medicine and has been involved with many peer-reviewed articles. And I've always enjoyed working with her as I've learned more and more about the genetics of dementia. Emily Dwosh.
Thank you, Lynn. Thank you for that introduction. Yes, I'm not a doctor. I am a genetic counselor, and I'm going to share my screen. Hopefully you'll be able to see my slides. All right. So as a genetic counselor in the Clinic for Alzheimer's Disease and Related Disorders, these are some of the questions I receive from our patients as well as concerned family members. Questions such as, is my condition genetic? Is there genetic testing? And if so, should I have genetic testing? So how do we answer these questions? Over the next 15 minutes, it's going to be tight, but hopefully I'll be able to provide an overview of the role of genetics in the four most common dementia subtypes. We'll talk about the availability of genetic testing for these conditions, and we'll also touch upon some factors to consider prior to genetic testing. So just as a reminder, the term dementia is a broad umbrella term that describes a set of symptoms, things like memory loss, disorientation, confusion, other areas of cognitive change, but it's a non-specific term. And underneath that umbrella of dementia are about 70 different conditions that can lead to these symptoms. The four most common reasons for dementia are Alzheimer's disease, vascular dementia, Lewy body disease, and frontotemporal dementia. And I'll just draw your attention to some of the acronyms that are on the screen, the short forms for these conditions that will come up later on in my slides, and I might refer to these conditions by their acronyms as we go through the slides today. So when we think of these four most common reasons for dementia, even though they are all different conditions, questions about their genetics, how they're inherited, and genetic testing options can actually be answered in a similar fashion. When we look at these four most common dementias, what's most important to recognize is that they all usually occur as sporadic conditions that are not directly passed on from parent to child and are not caused by any one specific thing. The cause of these sporadic dementias is described as being multifactorial because they're brought on by a complex combination of multiple factors. These factors fall into three categories: aging, lifestyle and environmental factors, and genetic susceptibility factors. So even though I've just told you that these conditions are not purely genetic, that's not to say that there's zero role for genetics. We are all walking around with different genes inherited from both of our parents that work together and in combination with our lifestyle and our environment to make us more or less predisposed or susceptible to developing these sporadic dementias as we live our lives. So how do these multiple factors all come together in order to trigger the onset of one of these dementias? We can look at sporadic Alzheimer's disease to illustrate this. You can imagine that we are all born with an empty jar that represents our chance of developing sporadic Alzheimer's disease in our lifetime. In order to develop sporadic Alzheimer's disease, we need to fill up our jar to a specific threshold level. And you can think of these pebbles as all of the different factors that contribute to our jar, leading us to develop Alzheimer's disease or not. So first of all, at the time that we are conceived from both our mother and our father, we inherit our genetic susceptibility factors for sporadic Alzheimer's disease. Some of us may inherit very few of these genetic susceptibility factors. Other people may start their life out with their jar a little bit more full of these genetic susceptibility factors. But what's important is that these genetic factors by themselves will never be sufficient to fill the jar to the threshold. We need to have other contributions. As we live our lives, we know that aging plays a significant role in our likelihood for developing sporadic Alzheimer's. So with every passing year, especially if we reach our mid-60s and onwards, we know that aging is also contributing to our jar. And then finally, we have those lifestyle and environmental factors. So we know from large research studies comparing healthy populations and populations of people with sporadic Alzheimer's disease that things like history of head injury, history of vascular disease or diabetes, some studies even suggesting that a history of mental health concerns, that these factors may contribute to our jar. And I want to emphasize that none of these things by themselves will cause Alzheimer's, but we think that they possibly play a role by contributing to this sort of overall combination of factors as we live our lives. So if you think of the jar and all the different factors that contribute to it, all of us are going to have a unique combination of these factors, but if our unique combination reaches that threshold, that will trigger the onset of sporadic Alzheimer's disease. So we can't do anything about our genes, and we can't do much about the aging process, but the good news is that we do know of some lifestyle and environmental factors that may protect us against developing sporadic Alzheimer's in our lifetime. And you can think of these factors as adding layers of height to our jar. So even if we have some of these other factors filling up the jar, if we exercise, if we get good quality sleep, if we're staying socially engaged and mentally stimulated, you can think of those factors as increasing the height of our jar, potentially letting us stave off reaching that threshold level. And we're going to hear more about these lifestyle and environmental factors from my colleague, Dr. Familial, later on today. One question that I often receive is whether or not there's genetic testing for this common sporadic form of Alzheimer's disease. The previous slide did mention that we know of more than 40 different genes that contribute to Alzheimer's susceptibility. And we know that of these 40 different genes, it's the ApoE gene that is actually the most influential. This is a gene that we all have. We all have two copies of it, one from our mother and one from our father. And the gene comes in three different varieties called ApoE2, ApoE3, and ApoE4. And we know that it's the ApoE4 variety of this gene that is considered the high-risk gene for developing sporadic Alzheimer's disease. To put it in a different way, we know that populations of people who have one or two copies of this ApoE4 version of the gene are statistically at a higher likelihood to develop sporadic Alzheimer's disease than populations of people who only have twos and threes. However, what's important to recognize about ApoE is that you can have one or two copies of the ApoE4 gene and still never develop Alzheimer's disease. And the reverse is true as well. Individuals without ApoE4 can still develop the condition. And in fact, up to about 50% of sporadic AD patients will have no copies of ApoE4. Because ApoE4 status isn't clearly predicting who among us is destined to develop sporadic Alzheimer's in our lifetime, clinical genetic testing to find out if you have one or two copies of the ApoE4 gene is not recommended, and this is not a test that's available as an MSP-covered genetic test here in British Columbia. That being said, ApoE testing is available from direct-to-consumer companies such as 23andMe. So these direct-to-consumer companies, they do not require the involvement of a physician-ordered test. This is something that anyone can just through their website order a saliva kit and submit a genetic sample for 23andMe to analyze ApoE status. The decision whether or not to find out ApoE status is going to be obviously highly personal decision, but I would encourage anyone who's considering pursuing ApoE testing to think about what the test does and does not tell you, to recognize the limitations of the test, and to think about things like, will the ApoE results impact your lifestyle? Will they perhaps increase your anxiety? And given the fact that your DNA and personal information will be given to this large company, 23andMe, issues such as privacy, confidentiality, and data sharing should also be considered. So what do we know about the impact of having a family history of sporadic Alzheimer's disease? Well, given that there's at least some role for genetics, it follows that having a close relative with this condition does increase a person's likelihood of developing Alzheimer's themselves. If we look at the general population risk for any one of us to develop sporadic Alzheimer's, the numbers suggest that there's about a 10 to 12% lifetime risk for any one of us to end up with this condition. If we have a close family member, a parent or a sibling with sporadic Alzheimer's disease, the recurrence risk, so that's the likelihood of the condition reoccurring, would be increased to about 15 to 30% lifetime risk. It's very important to flip that number around. So if you flip that number around, that means that there's a 70 to 85% chance that the children or siblings of somebody with sporadic Alzheimer's disease will not develop Alzheimer's in their lifetime. It's also important to recognize that those lifestyle environmental factors I mentioned earlier may also help mitigate risk if there is a family history. So just to summarize again, most dementia is sporadic and multifactorial, and that concept of the jar analogy of sporadic Alzheimer's disease also applies to sporadic cases of vascular dementia, Lewy body disease, and frontotemporal dementia. And you can think of each of these dementia subtypes having their own unique set of genetic susceptibility factors and lifestyle and environmental factors that, quote unquote, fill their jar. And researchers are working hard all around the world to establish these factors. So what about the other cases of these dementia, the more rare cases that fall into this category of familial dementia? As the name suggests, these familial forms of these conditions clearly do run in the family. And these familial forms are caused by spelling mistakes or mutations in single specific genes that can be directly passed on from one generation to the next. We know of several different causative genes that cause familial forms of each of these dementia subtypes. But it's important to recognize that mutations in these genes listed off here don't explain all cases of these familial dementias. And there are likely other familial dementia genes out there that have yet to be discovered. If a person has one of these familial forms of dementia caused by a specific gene mutation, the likelihood for their close family members to develop the condition, and specifically it's their siblings and children, would be increased to 50%. And unfortunately, I don't have time to go over exactly the mechanism to explain that, but if a question comes up, I'm happy to explain it in the Q&A session. So when we look at the familial and sporadic forms of these four common dementias, from a clinical perspective, there's no obvious distinction between the type that is sporadic and the type that is familial. So how do we determine which form we're looking at? The family history is very helpful to give us a bit of a sense of what we might be dealing with. So in familial dementia, what we're looking for are family histories where there are multiple relatives all with the same type of dementia. We're looking for that same type of dementia over several generations, and we're also looking at younger ages of onset. Another thing that can provide clues is whether or not there are clusters of related diseases in the same family. So are we seeing clusters of frontotemporal dementia and ALS in the same family? Or are we seeing clusters of Lewy body disease and Parkinson's disease in the same family? And these clusters can be helpful because we know that from a genetics perspective, FTD and ALS are related diseases, and Lewy body disease and Parkinson's disease are related diseases. So if we're seeing these things running in the same family, that does give us maybe a bit of a clue that this could be a familial form of these conditions.
2 minutes.
Thank you. So here's a family history that really jumps out at us as looking suggestive of a familial dementia with lots of people over many generations and the same type of dementia occurring in these affected family members, and also this clustering of related diseases like FTD and ALS. When we see families suggestive of familial dementia, the conversation may turn to the option of clinical genetic testing. So there is testing available for these conditions. The testing is available only at out-of-province labs, so they're not automatically covered by MSP. Funding is sometimes available through the BC Agency for Pathology and Lab Medicine. If no funding is available, it can be done as a private pay option. Testing can be done looking at one single gene of interest or a panel of multiple genes, and ideally would start with an affected individual. The two outcomes of this type of testing would be, number one, a positive result. So that would mean a specific gene mutation is found. This would confirm that the condition is genetic. It would confirm that 50% recurrence risk for the offspring and siblings of that person being tested, and those relatives would have the option of predictive genetic testing. The other possibility is that we have a negative test result, meaning no mutation found in any of the genes analyzed. This could provide some reassurance that the condition may be sporadic multifactorial. However, we can't rule out the possibility that the dementia could still be familial, caused by a mutation in a gene that has yet to be discovered. Additional testing may be available in the future with more gene discovery, and some families may consider DNA banking to keep testing options open for the future. Prior to any genetic testing, genetic counseling can provide education and support to families, allows for a detailed review of test implications and limitations, and really ensures that people who are thinking about having genetic testing are having an opportunity to really make an informed decision. Some factors to consider prior to genetic testing are listed here. Things like impact on family financial or future care planning, impact on family relationships, how this might impact a person's psychological well-being. And these are all the things that would be talked about in a pre-test genetic counseling session. So in summary, most dementia is sporadic and multifactorial. Rare cases are familial and genetic. Clinical genetic testing for familial dementia is available, but it's not always relevant or necessarily desired. Genetic counseling can help you understand the impact of your family history and relevant genetic testing options. And for anyone who is concerned about their family history, a referral to the UBC Alzheimer's Clinic for genetic counseling is an option for everyone. This is an MSP-covered clinical service, and it can be facilitated by your family physician. Our referral information is found on our website. Thank you very much.